Ladies and gentlemen, hello and welcome to my channel once again. This video gives a brief general description of the processes to be followed by the Medical Records Department of a hospital based on NABH guidelines. The topics mentioned here are MRD scope of services, administrative policies and protocols, making available patients' records and information, storage and retrieval of medical records, archiving or destroying medical records, maintaining complete medical records, continual quality improvement, training needs of MRD. MRD scope of services should be defined and documented and should be commensurate with the scope of services of the hospital. Should be understood well by the MRD staff and should be communicated to all. It is important to note that defined does not mean that the scope of services has to be displayed as well. If NABH has specified that it should be defined and displayed, then it has to be displayed mandatorily. But, as a good practice, you should display the MRD scope of services in a prominent place in your department. Administrative policies and protocols must consist of at least the following: duty hours and staff strength. If the department works in shifts, then shift-wise staff strength should also be defined along with the timings. Organizational chart of the department showing the reporting structure and the designations. Behavior code, moral and ethical values. Competency matrix. This means the minimum qualifications and experience required for each designation. Job responsibilities and authorities matrix. This means the MRD staff should be suitably skilled, qualified, experienced, and competent to perform their respective tasks. Compliance with applicable statutory and regulatory requirements. Protocol to be followed for emergency requirements during non-working hours. This means, what steps will you take if a doctor urgently needs past records of a patient when MRD is closed? Quality improvement initiatives of the department's processes and functions, as per requirements of NABH. Administrative policies and protocols should be developed, documented, implemented and reviewed from time to time, to ensure their continued suitability. Making available patients' records and information. Here, MRD should develop, document and implement a procedure for making patients' records and information available, to both internal and external sources. Your department's protocol should be to maintain confidentiality, security and integrity of patients' records, data and information. To prevent theft, misuse, damage, destruction. Remember to keep the department and the record room under lock and key when unoccupied. You should prevent unauthorized entry into the record room or storage room. The data and information maintained in the computer system should be password protected, with limited access to authorized persons only. Define a list of the internal and external persons who you consider to be eligible to access medical records, and the circumstances under which the medical records will be made available, and also the duration for which they will be made available. Internal will be doctors, dean, CEO, medical director, nursing director, the audit team. External will be patients and their relatives, legal practitioners who handle medico-legal cases, police. Define who will be authorized to give approval for issue of the medical records. This person should be someone from the top management level. To safeguard the medical records from theft, misuse, tampering, and unauthorized changes in the documents, you should have a system whereby only doctors, dean, CEO, medical director, and nursing director will be allowed to take the records outside the department. Others, like junior doctors, nurses, RMOs, paramedics, senior administration staff, and auditors should be allowed to have access to the medical records, but should not be allowed to take the records out of the MRD. There are certain information and data which are required to be shared with external sources, as per prevailing laws and regulations. For instance, certain types of medical data are required to be intimated to the local municipal corporation in their prescribed formats. A few such cases are notifiable diseases, dengue and malaria, medical termination of pregnancy, births, stillbirths, and deaths. There should be a documented procedure for making medical records available to the care providers when the MRD is closed. Need may arise under some emergency situation when the past medical record of a patient is sought by the doctor at a time when the MRD is closed. You need to define who will be authorized to give approval for issue of the medical records. This person should be from the senior management level. Who will be authorized to unlock the department or the record room to issue the record? Who will validate all such issues? This person should be from the senior management level. Your department should maintain a register for entering the details of all such issues. I have given here a sample format of the register. You may give the title, Register for Issue of Medical Records during Closed Hours. Here I have created 7 columns which I feel are most appropriate for this type of a register. The column headings are Issued to, Issued by, Date and time of issue, Receiver's signature, Approval given by, Issue validated by, and Returned to MRD on. You are free to modify the format and add your own parameters. Storage and retrieval of medical records. Here, develop, document and implement a procedure for storage and retrieval of medical records. You can store the files as per their unique identification number and issue a distinctive gradation system for easy identification and quick retrieval. Example 1, RA01, IP361, January 2021. Example 2, RA01, IP362, January 2021. Here, RA stands for rack. 01 stands for the rack number. IP number and year are the identification of the patient and the year of admission. All the medical records should be stored in a secure manner to prevent theft, loss, misuse, and destruction. Should be prevented from damage by fire, water, and pests. Archiving or destroying medical records. Here, develop, document and implement a procedure for archival or destruction of medical records as per legal requirements and as per NABH requirement. Define the time frame for which a record should be retained in the storage section before they are archived or destroyed. If you decide to archive the medical records at an outsourced location, then there should be a proper documented and signed memorandum of understanding with the outsourced vendor. It is preferable if you create backup of all medical records in your hospital's software system before archiving them to an outsourced location. This system backup should be password protected with limited access to authorized persons only. Maintaining complete medical records. As per standard IMS 3, all patients getting treated in the hospital must have complete medical records. The treatment papers should be maintained in a chronological order, starting from the time of admission to the time of discharge, containing the complete history of the treatment and care provided during the entire duration of the patient's stay in the hospital. This also applies for electronic soft copies of medical records. NABH demands that the contents of the medical record should be identified and documented. You can meet this requirement by creating a standardized checklist of the contents of medical records, mentioning the chronological order in which each document should be filed. The checklist should be made available in each patient's file. An example of the checklist. 1. Registration form. 2. Admission form. 3. Doctor's initial assessment. 4. Nursing initial assessment. 5. Nutritional initial assessment. 6. Medication prescription form. 7. Medication administration chart. The nurses should arrange all the documents in the file as per this checklist before sending the file to the MRD. If a particular column in the checklist is not applicable, then that column should be marked as not applicable. For instance, for all non-surgery patients, the relevant columns in the checklist can be indicated as not applicable. On receiving the file in the MRD staff should cross-check the contents of the patient's file with the checklist to ensure that all the records are present in the file. If any document is found missing, MRD should inform the concerned department or person immediately. MRD staff should ensure that the missing document is sent to the MRD at the earliest. If your hospital maintains medical records in electronic soft copy format, then the checklist should also be made available in electronic soft copy, with proper linkage to respective medical records of patients. Continual quality improvement. There should be sustained quality improvement initiatives under the guidance of the department head. Each and every MRD staff should be equally involved in all quality improvement activities. Maintain proper records of all the results and reports of such activities. Quality objectives and quality indicators are very effective tools for implementing quality improvement program in your department and for monitoring and measuring quality improvement activities. Setting quality objectives for process improvement and quality improvement is the requirement of ISO 9001. Whereas, monitoring the quality indicators for process improvement and quality improvement is mandatory requirement of NABH. ISO 9001 has not defined any quality objectives. You are free to decide your own quality objectives. But NABH has defined the quality indicators, which need to be monitored and measured mandatorily. KPI, PSQ4C. Percentage of medical records having incomplete or improper consent. MRD staff can check this KPI in the medical records files received in the department and document the findings in the KPI data sheet. Thereafter, submit the findings to the person who is responsible for monitoring the KPI data. The MRD staff can also collect KPI data for other parameters like missing records in the files of patients, files not having discharge summary, and files not having ICD coding. Each medical record file coming to MRD should be checked for these parameters. If any parameter is found to be missing, it should be captured in the KPI data sheet and informed to the concerned department or person without delay for necessary correction, corrective action, and preventive action. Similarly, you can also capture data for bed occupancy rate and average length of stay. While calculating this, do not include beds which are not in use or have not been commissioned for patient use. It is important to note that, as per IMS 4A, the MRD staff should codify all the diagnoses as per ICD-SNOMEDCT. Setting quality objectives for your department's processes is a good practice. It is preferable if you set objectives for all the critical and important activities of your department. For example, maintaining backup of all medical records, preventing loss or theft of medical records. The quality objectives set by you should be bound by a time frame, should be practically achievable, monitorable, measurable, and once achieved, should be sustainable. Do not discontinue an objective once you have achieved it. Keep on reviewing it periodically to ensure that you are able to maintain the attained objective. Training needs of MRD. Staff members should be appropriately trained based on their specific job descriptions. The topics selected for training should ensure professional development of the MRD staff. Training should also be conducted when job responsibilities change or when a new machine, equipment, or new technology is introduced. Evaluation of training effectiveness should be done properly. Plan the training program of your department in conformance with NABH requirements, document it, and implement it well. The head of the department should plan the training calendar of the department and ensure that the trainings are conducted as per the calendar. Training calendar should consist of the training topics, dates of training, name of the trainer, frequency of refresher and repeat trainings, as applicable. Training should be ongoing and a continuous process. Records of training, repeat training, and evaluation should be retained along with training evidence. Training evidence is the training attendance sheet. This sheet should contain the training topic, date of training, name and signature of the trainer, names and signatures of the trainees. Some examples of training topics for MRD. 1. ICD coding, this is NABH requirement. 2. Checking and indexing discharged files received in MRD. 3. Process of issuing files to doctors and receiving the files back from the doctors. 4. Proper preservation of both hard copies and soft copies of medical records. Evaluation of training effectiveness. Should be done immediately after the training is completed and also after a certain time gap. Immediately after the training is completed, you can carry out evaluation through verbal interview, through written test, or any other method that you consider appropriate. After a suitable time gap, you can carry out evaluation through verbal interview, through observation during work, or any other method that you consider appropriate. Non-conformances raised during internal audit and during NABH assessment provide a very good insight into the effectiveness of the training program. To conclude, if you need any further information regarding any topic related to quality management and process management, please put them down in the comment below. I will try to do justice to your requests in my new videos. If you have liked the information that I have shared with you, then please like my video and subscribe to my channel. Once again, thank you very much for watching till the end. Have a great day.